Dallas has become an increasingly international city. In fact, 25% of Dallas residents are foreign-born, and over 40% speak a language other than English at home. Despite a tremendous growth in local multicultural communities, there are few agencies in the Dallas area equipped to serve refugees and immigrants when they encounter crisis situations. Currently, Mosaic Family Services exists to provide culturally competent services to refugees and immigrants in crisis and make them aware of available social service resources. Mosaic was founded in 1993 by Dr. Walter Wen, who came to the United States as a refugee from Vietnam and who saw many needs among other immigrants adjusting to life in America. At first, Mosaic focused on assisting individuals in accessing medical and mental health care. But soon, we recognized that there were also very limited services for foreign-born victims of domestic violence and other crimes in the Dallas area. So we began providing case management for survivors of domestic violence in 1997 and began serving survivors of human trafficking in 2001. That same year, Mosaic House opened its doors as the region's first shelter to serve victimized immigrant women and children. As other unmet needs within the community became apparent, Mosaic continued to expand its services to include multicultural counseling and legal services in the areas of both family and immigration law. Refugees fleeing war and genocide often have limited, if any, exposure to Western medicine, and therefore struggle to access health care for both emergency and preventative care. Additionally, while family violence affects all communities, women and children within refugee and immigrant communities are extremely vulnerable to abuse. Many come from countries with no laws against domestic violence or child abuse. Some come from countries that don't enforce the laws they have. Due to limited English and a lack of knowledge about American laws, many foreign-born Dallas residents are also vulnerable to other forms of victimization, including human trafficking, since Texas is one of the 4 states nationwide with the highest number of trafficking victims. Mosaic aims to provide the multicultural communities of Dallas with comprehensive, culturally sensitive social services. We've expanded and evolved over the last 20 years to meet a variety of needs as they've been exposed. For instance, when we saw domestic violence and human trafficking in the communities that we were already serving, we got involved. As a result of our work, we've seen an increase in willingness from local refugee and immigrant communities to seek our assistance. We've served more clients each year that we've been in existence and hope to break the cycles of violence within these underserved communities. By providing culturally competent services, we hope to empower local multicultural communities to overcome the obstacles they face, transforming Dallas into a vibrant, diverse city. Mosaic is successful because of our multicultural staff and board. We not only aim to serve refugees and immigrants, but our staff and board are also former refugees and immigrants themselves. My family immigrated from India, and I am also fluent in French. Our staff is fluent in over 25 languages, including Arabic, Hindi, Mandarin, Russian, Spanish, Swahili, Thai, and Vietnamese. We've seen that when our staff shares the same culture and language as their clients, they have a greater success in reaching, rehabilitating, and educating them. For example, when our Farsi-speaking case manager works with an Iranian survivor of domestic violence, she can show that it is possible to leave an abusive relationship without abandoning her culture. To best address the needs of refugees and immigrants in crisis, Mosaic provides a spectrum of services, including case management, shelter, counseling, and legal services. Our recognition of the need to be comprehensive came from our experiences working with these populations. Refugees and immigrants face a multitude of barriers, including limited English, poverty, lack of transportation, cultural differences, and a lack of knowledge of American law and their rights. These individuals are often unaware of available resources and how to access them. When facing the daunting task of navigating the complex web of social service agencies, The barriers our clients face often seem insurmountable. Mosaic uses intake and exit surveys to gauge the impact of our services. In 2011, our victim services programs served close to 400 domestic violence victims and approximately 100 victims of human trafficking. Our services also benefited more than 500 children of our adult clients. 88% of survivors reported that their safety and the safety of their children had improved by 75% or more due to participating in the services provided by Mosaic. 91% reported that their knowledge of their rights and available resources and how to access them had improved by 75% or more. Our Refugee Health Case Management Program served over 700 individuals from more than 20 countries. 88% of refugees served by the program improved their knowledge of the healthcare system and how to access it by 75% or more. Across the United States, there are few agencies providing such comprehensive services for victimized refugees and immigrants. And in the North Texas region, we're the only agency of our kind. Yet we remain largely unknown within the general community. Although we're known within local refugee and immigrant communities and receive many referrals through word of mouth, most Dallas residents are simply unfamiliar with our organization. Mosaic has grown from an agency with 6 employees and a budget of $250,000 to an internationally recognized organization with a budget of $3.1 million that employs 52 individuals who are collectively fluent in over 25 languages. We're proud to see an increase in knowledge of family violence within the refugee and immigrant communities of Dallas as a result of our services. During the first 6 months of our multicultural family violence program, the agency served 1 client. Mosaic now serves nearly 400 victims of family violence each year. We also co-founded the North Texas Anti-Trafficking Task Force and have served over 300 survivors of human trafficking. Mosaic raised the funds to start a shelter designed to help battered immigrants, and we've sustained it for over 10 years through diverse funding sources. Our Refugee Health Case Management Program was the first of its kind in Texas and has been widely recognized as a model program. It's grown from serving 100 refugees a year in 1993 to serving over 800 refugees in 2011. Also in 2011, Mosaic's executive director, Dr. Wen, received the Texas Association of Young Lawyers Liberty Bell Award in honor of our ongoing work to assist immigrant victims of crime in accessing the justice system and understanding their rights. Mosaic receives over 70% of its funding from state or federal government grantors, making the organization extremely vulnerable to funding inconsistencies caused by bureaucratic delays and political stalemates. In 2010, we experienced a 9-month gap in the federal funding which supports our services for victims of trafficking. Through emergency funding from several local foundations, we were still able to maintain the program. However, this funding delay brought urgency to our ongoing efforts to increase support from individuals, foundations, and corporations. Mosaic is the only organization in North Texas with a diverse multilingual staff and equally comprehensive services to assist victimized immigrants. The demand for our services has increased drastically. Even with 4 attorneys on staff, we have a 1-month wait list for legal services. Clients seeking counseling may also wait up to a month before receiving therapy. Additional resources would enable us to expand our existing programs and hire additional counselors, attorneys, and case managers. Then we would be able to respond more quickly to address our clients' urgent needs. Increased funding would also enable Mosaic to build a new shelter with more beds. While our current shelter provides housing to approximately 200 women and children each year, we annually turn away over 100 other victimized immigrants who are otherwise eligible to receive our shelter services. Mosaic currently focuses on addressing the needs and struggles of first-generation refugees and immigrants. However, more than one generation benefits from our services. There are few organizations targeting the children of refugees and immigrants to help them through the obstacles of navigating two cultures and overcoming histories of trauma. Mosaic currently provides very limited services for the children and youth residing at our shelter, but we'd like to provide more long-term support for our clients' children exposed to family violence or human trafficking. Mosaic would also like to lead a refugee youth mentorship program, which would work alongside our other programs to help ensure that refugee families in the Dallas area succeed in the long term.